whatsoever.
Okay. My name is Jennifer Lavender. I'm one of the veterinarians at the Animal Hospital. Like I said, I've got a partner, Dr. Sarpong, who's there with me also. I graduated from vet school in 2001. My practice is general practice, but I do have a special interest in especially orthopedic surgery, like Jen said. Jennifer mentioned that when we think about hospice, probably the first thing that comes to mind is a place or a building, and it's interesting that we've taken that word from the human side of this, and yet it in some ways applies to us, and in some ways it really doesn't. They have some things at their disposal that we don't, and vice versa. We have some things at our disposal that they don't. What I want to try to do for you today is answer some of the questions that I heard you guys mention about timing and what happens and what to expect. And I also wanted to just kind of give you an idea of how the veterinary community sees pet hospice. Basically, again, like Jenna said, it's a philosophy and it's a process. It's not a place, but it's a philosophy that really promotes an alternative to an animal dying in an impersonal or very clinical situation. The goals of pet hospice, in my opinion, are one, providing a safe, caring, intimate environment during those last stages of that animal's life. It's also managing pain or other symptoms that may come up during that period. I'll get to that a little bit later. Offering emotional support, and certainly for the people and the owners, which Diane will talk about a little bit later, but for these animals also, and realizing that they're going through a lot. And it's a very confusing time for an animal, especially since they can't talk, and so many of the decisions that have to be made, we're their advocate, and we're having to trust our instinct. And I think that's the hardest thing for you as the owner, and it's a hard place for us to be also. This is so important, but giving owners sufficient time to come to terms with the diagnosis that's been made, to adjust to what kind of prognosis or time might be available, and help them really say goodbye in whatever capacity that they need to. I think that there's always the fear, like you mentioned, that you've kept it going or kept them alive for too long, and I think that, I'll get to that a little bit later too, but I think that comes up in every single one of these situations. And the one thing I can say is that it's okay to need that time to a certain extent, and I think that you do have to really rely on a veterinarian that you trust in helping you to realize when that is. So ultimately for me, hospice is recognizing that very, very unique bond between the owner and the animal, and working with the veterinarian to honor that bond through the development of a management plan for that pet's last remaining time, however long that is, days, weeks, months, years. But it's a plan that I think everybody needs to be on board and on the same page with. One thing that was very surprising to me when I started reading through all this is that when Jennifer mentioned to me about speaking, I thought, oh, pet hospice and death, and I really felt like it's something that, although I deal with on a daily basis for my clients and with their patients, I really didn't feel like I had ever been. I've been very fortunate. I haven't had to make those hard decisions for my own pets, I thought. My 15-year-old Sheltie passed away in September, and what I realized was that although she didn't have a terminal disease, she had chronic bronchitis. It was still something that I couldn't fix. I couldn't take it away from her. All I could do was manage it and do the best I could. It called into question all of the quality of life versus quantity of time aspects with her. When it finally came to the point that I put her to sleep, it was because she had a very, very violent seizure. And what I realized looking back on all this is that I did have a plan. My plan was to keep her as comfortable as I could. If that meant lots of steroids and she had a shorter life, that's what it meant. When she crashed on me, I chose to euthanize her. I had a plan. She was under hospice care. I hadn't put that title to it, but she absolutely was. And so I think we find ourselves in that situation a lot more than we realize it without maybe putting the verbiage to it. When I talk about this plan, as I mentioned before, I think it's so important that it's something that you have been very frank with your veterinarian about what your ethical beliefs are towards end of life, towards euthanasia, towards quality versus quantity of life. I think that you really need to make sure that they understand what your emotional needs are so that they can help honor the your choices and your decisions, and yet at the same time help you to understand when maybe those, you no longer have the luxury to do that. I think that it needs to be set up early. Like with my dog, I didn't realize that I was in hospice when I was, but I think really talking about it from that standpoint, talking about the plan and talking about it often, because it is something that changes. When I say setting it up early, a couple of kind of benchmarks as far as when is hospice right, or when do we consider an animal under hospice care. I would say once we realize that this animal has some kind of disorder or disease that we cannot cure, we may be able to somewhat manage it or slow down, but if we cannot cure this disease, from that point forward, everything is a management and quality of life plan. I think it's important to talk about whether or not the owner has enough time and financial resources to really devote to a hospice plan. If you're going to be gone 20 hours a day, that may not be the best situation to have a critically ill animal in your home. I think those are valid concerns, and again, I think it's important for the veterinarian to be very upfront with what this animal's care is going to require and find out if it's something that's reasonable or not. I'm not sure the best place to mention this. It's kind of talking about how it's a plan and it can change. I am going to mention Bella now. I had a client who I had the unfortunate experience to have to tell her that her dog has osteosarcoma, which is bone cancer, and it's an extremely aggressive and fatal cancer, and it's one that we really have nothing to fight. Chemo doesn't work, radiation doesn't work, it usually attacks the limbs, and the best thing that we can tell people to do is to amputate that limb as strictly a palliative procedure. And when I made this diagnosis, the initial response from my client was, I'm not going to put her through surgery, let's just put her down. And that's not a wrong decision at all, that's the decision that was initially made. And I think knowing that this animal had been limping, it was obviously in pain, is a reasonable thing to say. She asked me, what would you do? And what I said was the only wrong decision is to not put her to sleep and not amputate. If we amputate, at least we've taken away the pain. We haven't changed the fact that she's still not going to be here much longer, or we put her to sleep. And so what we decided was to basically give her lots of pain meds, send her home for the night, let's think about it, let's come back in tomorrow and regroup. And the next day when she came in, we had planned on euthanizing, and we talked about it for a long time and ended up deciding to go forward with the amputation. And I think that everyone's happy, at least at this stage, with how things are going. And I don't know how long we'll have her with us, but from that moment when I walked in the room that first time and said, Ella has osteosarcoma, it became a hospice plan from that point forward, regardless of the decisions that were made and the way the plan has been tweaked and changed along the way. I think it's real important to have someone that you trust and you can work with from that aspect. Once that diagnosis has been made, some things that the plan involves. One is obviously treating the specific disease. Just because we can't fix the fact that your cat is in renal failure doesn't mean that we can't manage it in some way. If that's sucking fluids or anything else, you still try to address the disease as well as you can, slowing it down. I think pain and anxiety management and medication is very, very important. This is another time where it's real important to talk to the owners about what their comfort level is. Oral medications are great. If a dog is vomiting or a cat's vomiting, that's not a realistic way to get medication down. Is this something where the owner is going to be able to give injections and the veterinarian feels comfortable sitting at home? There's also a lot of things that can be given rectally. And for some reason, I don't know why, but in the veterinary community, we just don't send home suppositories and rectal medications a lot. The one that I think of most commonly is Valium. It's a fantastic thing to be given rectally. And if you've got someone at home with a dying animal that could potentially have a seizure, I can't fathom why you wouldn't give them some way to fight that or slow it down until they can get them somewhere. So, I think it's important to always be thinking of what else, and to have a veterinarian that's willing. If you find something, and sometimes it's crazy and sometimes it's not, but on the internet, if you come, they should embrace you doing that research and either tell you, no, this is why this won't work, or